Welcome back, everybody.
Yay, we're on episode 3, which is like so much fun.
Yeah,
I feel like we've been having so much fun doing this.
I know. I look forward to it. Steph's always so busy, so when I get to see her like once.
How many times are you gonna tell people how busy
really
I am?
Excited. But look, we have microphones. I feel like we don't have to yell this. Like we don't have to yell anymore.
I know. It's like so cool. So cool.
But what we wanted to talk about today was mastectomies, because mastectomies are obviously a really important topic. Steph and I actually had the same exact doctors for everything.
Yeah.
So we can definitely relate on our mastectomies, but that's what we're going to talk about today.
The number one question is it a mastectomy or a mastectomy?
I say mastectomy.
Like I say mastectomy too.
Yeah, mastectomy.
Like when they're like, "Oh, you had surgery." I'm like, "Yeah, I had a double mastectomy with recon." And they're like, "You mean a mastectomy?" And I'm like, "No, it's
mastectomy."
I don't know. I guess like that's a question for like a doctor, but whatever.
I didn't know anything until I was diagnosed. Like I was just like, your tits chopped off. Like I didn't really know.
You're gonna get a free boob job.
Yeah, free boob job. Like I was so naive. Just like, everyone right now is so naive. Like, oh, well, at least you get a free boob job. Like I would be the one saying that to other people in the past.
100%.
100%. Like so stupid. But now that I think about it, I'm just like, damn, like these people really be out here saying it. I mean, listen, the girls are looking fine right now. So I'm not mad about it. But like the shit we have to go through for that free boob job.
Yes, absolutely. And I actually had 28 fractions of radiation. So my girls, one's a little bit tighter than the other, to be honest. But no, I mean, overall, like I'm very, very happy with the outcome of my surgery and with even post-radiation too. We truly do have the best doctors.
Oh my gosh.
I'm very certain that I'm not being biased. Like we truly do have the best doctors.
The doctors make a difference. Like
it's huge.
The fact that like we're comfortable talking to them, like we have their numbers to text them if we need anything. Like they're checking in, are you okay? That makes a difference. If you have a very unemotional doctor, then
or like one that just like doesn't care, that it's like you're just a number. Like I totally felt so just like safe, like I everyone was like, oh my god, Stephanie's gonna have like a huge surgery, it's gonna be like, oh my god, I don't know, it's gonna be like 8 hours long. And I was like, if Dr. Mautner wants to take 12 hours, which I mean, poor chick if she does, but I'm saying like if she were to want to take 12 hours, I would be like, by all means.
I trusted her with everything.
I literally did trust her with my whole entire life, but it was just like so nice to have that experience where like, having someone like genuinely care about you. And it's funny because it's like, some doctors, it's like one cares about you but not the other, but it's like Dr. Salinas did an incredible job too, and just like making sure that I was okay post-op, and his team is phenomenal. They're great. The nurse practitioners and the PAs and stuff, it's great. I mean, like, again, so lucky.
Yes. So we have multiple surgeons. So when you go for reconstruction, you're going to have a surgical oncologist, and the surgical oncologist is the one that's going to remove the tumors, the lymph node dissection, and all that fun stuff. And then if you decide to go flat, then that's it. You're done there. If you decide that you want to have reconstruction, get a free boob job and, all that, tummy tucks, fat transfer, any of that, you're going to have also a plastic surgeon that's teamed up with the surgical oncologist. So
there's also like no right or wrong answer. It's strictly like whatever you want to do, which I feel is pretty cool because like you go through so much after being diagnosed and like going through chemotherapy and stuff. It's really exciting to go to these like appointments because it's like probably the only appointment that you're face to face with the doctor that you're able to make the decision that you want to do, because it's like you lose full control once you get diagnosed. It's like, all right, just take me with you, like,
take me away.
Take me away.
Here's my body. Honestly, everyone's seen me naked. The janitor seen me naked like 30 times. Like at this point in my life, I don't know what about you, but I don't even put the robe on anymore. I just take my shirt off.
Oh, 100%. When I went through radiation, I was like, I'm not going to go through this whole process of like, oh, don't see me.
No.
Like, no. I was,
Yeah, no, and that's how I am right now. Even like with like friends, family, I'm just like, I don't even care. Everyone see me. So, but yeah, having a doctor that you trust definitely makes a difference. So my advice would be like, if you don't trust or you don't feel comfortable with your doctor to talk about like your deepest, darkest secrets, and
Move
maybe
on.
that's not.
Yeah, it's like thank you next.
Yeah, it's not.
Yeah.
Bedside manner it means a lot.
Yeah.
You know.
So I have a question for you. So how did you prepare for your mastectomy? Like, did you have a support like from like an organization? Did you, I mean, I'm assuming you had a lot of support from your family as well, but what were things that kind of like helped you prepare for, you know, like a big surgery like this?
So I don't know if you know this, but I actually did multiple surgeries. So I didn't go straight in for the mastectomy.
Well, I remember you telling me that.
So for me, your surgeons are going to give you options. So basically, our surgeon, her name is Star Mountainer out of Baptist. She's the best. So basically, the oncologist, in my opinion, and even any surgeon, they don't tell you what they're going to do. They're going to give you options. Mm-hmm. So my first appointment with her, she drew out different options.
I still have her drawing.
I have it too, with the boobs and nipples, everything. Yeah, and my plastic surgeon as well.
Like
he drew.
So
I have all the drawings. So basically, what they do, what's a lot of doctors do. This is not us being doctors telling you what's going to happen. This is what happened with our doctor. So they give you options. Hey, this is surgery number 1. This is a lumpectomy. If you do a lumpectomy, we're going to remove the tumor, and then you're going to do some radiation around the area to get all the cancer cells out of that area. Or we can do a mastectomy. You can do one mastectomy just to remove the one boob that has a tumor, or you can do a double mastectomy to keep them even. So they draw out different options for you, and you're going to choose. And in my opinion, I think the reason why they give you options is because if they choose for you and you end up passing away, you know, get a reoccurrence.
Oh gosh.
They're going to try to, we as patients are going to try to blame somebody, right?
Right.
So they'll give you the option. You pick what you want. So I already knew going in. So before I chose anything, I did my research. I went on TikTok, talked to survivors. I belong to a couple of nonprofits here in Miami, and about 99.9% of the women that I talked to between the ages of 30 and 90 years old all advised me to get a double mastectomy. Mm-hmm. They all did. So I went in there like, I'm getting double mastectomy. So before she even started drawing, I was like, I already made my decision, but bring me some options. Let's see what's going on. So for me, that was already my choice. But I had one breast where my tumor was bigger than the other one. So that is a sign of cancer. And I didn't know that. I just thought a sign of cancer was a lump on your breast and that was it. But one of my breasts where the tumor was actually got a little bit bigger. People would only notice it maybe if I was like naked, you know, but through clothing you could not tell. And I was very heavy chested, so no one could.
I was just going to say, this is like kind of TMI, but like what size were you before?
34 double D.
Oh, wow.
Yeah, yes. Natural, yeah.
Wow, that is pretty impressive.
Yeah, so you met me post chopping of the titties. So for you know, I chose the mastectomy. I saw the plastic surgeon after, and then he was looking around. He's like, listen, in order for us to make things gorgeous, you have the best, you know, rack in Florida.
Ooh, okay.
We need to do this in 2 parts. Right. We need to do one surgery where we're going to do a lift and a reduction because that tumor breast was a little bit bigger. So he felt that was going to be needed. So he talked to Star, which is a surgical oncologist, and they came up with a plan to do a lumpectomy first. So lumpectomy to remove the tumor, and then reconstruction, which would be a breast lift and also a reduction.
Oh, so okay.
So I started out with, I had a total of, I think like 6 surgeries on my breasts so far.
Wow.
Yeah. So we'll get into that, you know, a little bit later. But in order for me to prepare, you know, just did a lot of research, a lot of Amazon purchasing, spent thousands of dollars on all the different things.
At least you look super cute, you know.
Yeah. So, what about you? How did you prepare for your bilateral mastectomy?
So honestly, obviously our stories are very different, and our cancer diagnoses are like very different too. I actually had 0 options. Like I was not able to make a choice. Like there was just like one plan, and that was it. Which, to be honest with you, like I'm okay with, and I thought it was the best plan. So
tell us
kudos
like,
to that
about why that was your only plan.
So I was diagnosed with metastatic invasive ductal carcinoma. And when I was diagnosed, my tumor and Dr. Mautner, please correct me if I'm wrong, but it was against the chest wall. So I had to go through 6 rounds of chemotherapy and then a liver ablation in between. And then following that, I had the mastectomy with recon and then 28 fractions of radiation. But that's for another day. But yeah, so I basically like didn't have a choice. It was like, we need to chop these off so that you can survive. And so that's exactly what we did. But it was, I mean, again, the best decision that ever happened to me, but it also was just like the thing to do.
Yeah. So the reason, because your cancer had spread to your liver.
Correct.
So for you decided, you know what, that's it. Like, this thing already spread. Let's get these things off.
Well, yeah, because it's like once you're in that position, there is, again, like there really isn't a choice. Like you like don't have a choice. It's either you leave it and, you know, like you're whatever happens.
How are you like presented that? Like, hey, either you don't do this and you have a chance.
No, there was just like no option. Like I went in like face on, knowing that I was going to get through it. And I was like, give me what you got. And that's exactly what Dr. Mautner did. And she basically just like said, this was the plan. And I, again, still have the drawing of, you know, the 2 breasts that she drew out, the plan that she was going to do. And then I think it was like, you're going to do 1, 2, 3, 4, 5, 6. And then, we're going to get through this together. And I literally just followed her game plan. And that's why I'm here today. So yeah, it's great.
Cheers. To survival.
I'm such a tea drinker, by the way. So that's why like I love tea.
We're drinking, this is tea. This is not wine.
It's like sparkling tea, which is like
still sober.
Yeah, it's super delicious. But yeah, so that was like my whole situation. And preparing, like, I don't think there's really anything that prepares you for this. But I will tell you, and it could be just me. I mean, the surgery is still a very big surgery, and it's something that's taken away from us as females. But I am a strong believer that that's not the way you should look at it. You know, like, not that it's a free breast, you know, job or whatever. Like, it's not like a free boob job. Sorry.
Breast augmentation.
It's not a free breast augmentation, because there's so much work that, you know, so much time, work, and like money that gets, you know, that you have to invest into just like surviving. But I always feel like after a mastectomy, like your boobs look way better. Like, I don't know, but yeah, shitty titty, like that's what I had before. So it's like, I'm super happy with what I have. And like, they're small, they fit my body size, and like they fit me and my personality. And like, that's, you know, like that's the best thing that could happen.
Yeah. And listen, I promised myself ever since my mastectomy, I'm like, I'm never wearing a bra again. I am freeing the nip for life.
Yeah, 100%.
Like, 100%. We worked way too hard for this shit. And you know what? Another thing, yeah, free boob job. Yeah, absolutely correct, because we are allowed to get free boob jobs till the day we die.
100.
So I'm gonna be like 99 years old with the nicest tits in the USA.
Sign me up. Like, let's do it again. Like, no, just kidding. But no, you're right. Exactly. That's why I'm saying, like, there's so much time and work that gets, you know, that gets put into the free boob job.
Yeah.
And it's like, no, it's not free. Like, you know, it's not like you could just wake up, go into surgery, and just like get it done. No, there's so many steps before that, you know, for you to get the free boob job that people say.
Yeah.
I got that so many times, by the way. It's like, well, at least you can, you know, finally go bigger and like get the boob job that you always wanted. And I was like, yeah, you're right. Which is fine, you know? But
I was so used to being heavy chested that now, I mean, they're like a C now, and I'm just like,
I feel like, but it's beautiful.
I know, but they're beautiful.
So
and
they fit your size and like your body type, which is great.
Yeah, no, I'm not mad about it.
But yeah, another thing that like also really helped me, and I'm sure it helped you as well, was rosemary. I remember after chemotherapy, I met with her for like coffee and stuff, 305 Peen Pack, and she kind of gave me like the tips and tricks. And I'll never forget, this is like something that like I will never forget, because again, they don't teach you this, and they don't also tell you. But I remember her telling me like the day before my surgery, she's like, take a hot shower, because it's going to be like the last time.
My friend Dana told me that too. She's like, last time you're going to feel warmth on your chest.
Honestly, that was something that she told me, and like I remember it still to this day, and I actually have carried those words and that statement to like the people that I've helped, and it's so true.
It's true. So for like those of you who don't know, when you get a bilateral or a mastectomy, anything, they scoop out like your nerves,
everything, your nerves,
artery,
and,
anything. Yeah. So basically, from like here to here, it's kind of numb. Under the armpits, numb.
Which is crazy because sometimes I'm showering and it's like really hot and I don't feel it, and then I see like my chest just like red. It's so crazy. It's like it looks like I like literally walked out of a sauna.
The doctor says, in a couple of years, there's chances that nerves might find their way back together.
Yeah.
But like our nipples have a mind of their own, so they will get hard whenever they feel like it.
See, I don't have that issue. But when you tell me that, I'm like, I don't know, maybe it happens and I don't like notice.
So when you're cold, your nipples don't get hard because or do yours always get hard?
No, like I just feel like they do when it's cold. So, So when I'm you're right. Yeah.
I'll be like, but hanging out
like
warm.
naturally happens too for like women that have not gone through it. So I feel like but whatever.
Yeah, no, there's no like control.
There's zero control. So
it's not like
zero control.
It's hard. If it's hard, it's hard. Like kudos.
Yeah.
So
thanks for looking at them.
So that's one thing. I mean, the numbness is a little weird, I must say.
At first, it was very weird.
It's very weird, but I don't know. Like now, it's starting to get a little bit better. But
yeah, sometimes like people, like my niece will accidentally like kick, like my chest. By the way, she's like 2 years old, so it's fine. But she'll kick it, and I'm like, you feel pressure, but like you don't really like feel sensation. It's like very, very weird.
Yeah.
Very strange. But yeah, so okay, so we spoke about that. What about post-operative care? Like what?
My story is a freaking disaster.
So, I don't know. I could be a robot, but like I was on the treadmill the next day. Yeah. But walking, not running. I
was back under the
I swear I don't wear a superhero cape, but I was just to get like my body moving and stuff. I felt like I was very excited. I felt like that was like my goal. My goal was to get to my surgery, and I feel like the day after surgery, I was like, I did it. And I got a free move job. No, I'm just kidding. It was like, and I was like walking on the treadmill, but just also for circulation, like it's really good to do that and stuff. And I went on walks with my husband, and it was great. It was awesome.
Lucky.
But no, not to brag, I swear. No, but it was like something that, helped me also after, which was like super important. Yeah. So wait, what happened to you? I want to know.
So I did the lumpectomy with the recon, so lift and reduction, and that surgery went very well. I would say like a 7 to 10 day downtime. I drove after like a week.
See, that I didn't do.
Yeah, I was pretty good with that. And then I did chemo, and then I did the bilateral mastectomy, which none of us wanted to chop them off because they were so cute. The lift and the
I remember seeing you.
God, they were adorable.
They were so cute.
Like before we went to the operation, we were like all looking, even like my surgeon, like, oh, they're so cute. We don't want to take them off, but whatever. So I woke up, did the mastectomy. It was success. Woke up the next day with a giant hematoma. I had a hematoma the size of a melon.
I do remember this.
Like a small watermelon. It was huge. It was hanging out of my chest. Really scary. It was so painful. So I went back under the knife. They drained the hematoma, whatever. And everything was
I went back under the knife.
Back under the knife. Yeah. Everything went well.
That's not funny, but really funny. No, I like that.
It's funny, but now I can laugh, but at the time.
No. That's
sucked.
Yeah.
But because you hear all those horror stories like, oh, everyone gets infections. I'm like, oh, that won't be me. Like, I'm fine. So I got the mastectomy. For some reason, I had my drains in, and the drains were draining, and they were nonstop. So most people have drains in between 1 and 2 weeks.
Did you have 1 or 2 drains?
I had 4 drains.
So you had 2 on each side.
2 on each side. After like the first couple weeks, like the first 10 days, I got the first set of drains out, but then I kept draining a lot. Like I was draining an abnormal amount. Like I could not wear clothing. Like I had to go buy weird clothes that fit because there's these 2 drains with these 2 things. I was planning for my brother's wedding. My brother was getting married. So when I scheduled the surgery, I said, will I be out of drainless in 4 weeks? And typically yes. So the surgeon said, typically, yes. I don't mind making any promises, but you should be fine. And sure as shit, my brother's wedding comes literally 4 weeks after, and I'm still in drains. They did not want to take the drains out because since I kept producing drainage, it's a little skeptical. Like, you don't want all that to fill up back into you and cause an infection. So we kept them in. Went to my brother's wedding, which is fine. I ended up not being able to wear a long, tight gown. I had to get like a flowy little like princess dress, which was cute. Did my brother's wedding. Next morning, woke up. I was just like not feeling okay. Like I felt tired. I was like, we went to bed at like 6 a.m. That's probably why. I don't party, so I didn't drink. And I don't know, it was just feeling really shitty, like feverish, chills. So I went back to my parents' house and like took a nap, and I woke up in excruciating pain. My breast was on fire. I had a high fever, called the surgeon.
So you were like symptomatic.
I was sick, really sick. It felt like I had the flu. I was crying. Like I don't cry very often, but like I was scared. I was like, something's wrong. Called the surgeon. I have his number, and he was like, pack a suitcase. You're going to be staying in the hospital for a week. Something is wrong. So he prescribed me antibiotics. I took those immediately, packed up, went down to the hospital. They admitted me, and, they gave me antibiotics. Antibiotics kind of like worked. They were doing its job.
I was going to say, they were doing its
job. So what he was going to do was that he was going to go back in, take the expander out. So an expander is what we put in after a mastectomy to expand our chest wall and the skin to prepare for a boob job or a breast implant. So when you do a mastectomy, you cut everything out. You can't just put a boob in there. Yes, you can. Some people qualify for it.
Because you need to expand the chest.
You need to be able to expand the
chest. The skin, yeah.
So I wanted to get a decent sized breast, so we had expanders in. So he was like, all right, well, I'm going to go in, take the expander out, and put a wound vac in there just to kind of clean out everything. But I took the antibiotics, and like 2 days later, like I was like feeling better. So what we did, he was like, all right, let me just go in there and clean out the expander. So he went in there, took it out, and they like tested, everything. And I had a staph infection. So this was actually a staph infection. So somehow I got a staph infection. So I was in the hospital for a week, came out, whatever, did my thing. I was okay. A month later, I was 2 days pre-op to get my expanders replaced with breast implants. My boob was red. I was feeling sick again, and bam, I got an infection.
No
So
way.
They put me on antibiotics again, and they're like, well, surgery's in 2 days. You should be fine. Like, let's put you on antibiotics again. So I go back on antibiotics and go back in for surgery. Surgery was a success. But I continued to have an infection, continued to have drains. So I was on antibiotics for an entire month.
Wow, that's crazy.
So now I got my last surgery February 5th. We are about 3 weeks post my last antibiotic. So I had 3 weeks without antibiotics right now.
That's good.
I feel good. Oh, fuck. I feel good. I saw my plastic surgeon on Friday, which was 2 days ago. And breasts are looking really good. We do have a complication. I have capsular contracture. Contracture. So basically, because of all the infections, my own tissue try to protect my body from the implant, since it's like a foreign object, and kind of went over it and created a hard wall. So in 6 months, we are probably going to go back in for surgery, because right now it's like a little tight.
They look great.
They look great, yeah. It's just to me, I can feel the tightness, and it's still a little sore. The right one is so cute, so beautiful, squishy, like a little normal boob. The left one, where the infection kept occurring, it is a little tight. So we're going to stay surgery-free for the next 6 months, and then go back and give me the best boobs in Florida. So my journey's been a long one. A lot of ups and downs, but I'm really happy with my results. And honestly,
good. I feel like that's important.
Definitely like how I look right now. And when you first hear double mastectomy, you're like, I Googled shit, and you see boobs hanging down, scars everywhere, looking horrible. But because there was no cancer under our nipples, we were allowed to save our nipples. So that's another reason why I'm positive about this. because, you know, if there was cancer inside the nipples, you have to remove the nipples. So a lot of women, especially women who have triple negative breast cancer, stage 4 cancer, there has spread, you know, into the nipples. So some women have to just have like, you know, a breast implant with tattooed nipples. But we were able to save ours, so we have normal looking breasts.
Yeah. So lucky. So lucky. But yeah, I feel like we shared our stories. It would be really cool to have, you know, people talk to us or like comment below, you know, on our posts, and we would love to hear your stories. And also, if you have any questions, reach out to us. We would love to help you. If you have an upcoming mastectomy, an upcoming surgery, and you want to know like our tips and tricks, or if you have any questions, again, we're not doctors, but we would be more than happy to help you and guide you and support you and just be there for you every step of the way.
Yeah. Well, now that we're talking about tips and tricks, we didn't even give any tips and tricks. So what was like your number one go-to?
The pillow.
So the pillow that went around you or under you?
No, so I had pillows, like I was, so actually, and also get a reclining chair. Mm-hmm. That was like huge for me.
Yep.
It was pretty big, but like I was like on a reclining chair with like both of the heart-shaped pillows that Rosemary gave me, and I would just sit like this, and I just felt like my boobs were in place, my boobies were in place, and like my arms were good, and it was just like so nice to recline because you do feel like the weight on your chest getting up and down. So that would be, you know, my tip. Another thing would be like when it's time to shower in a garbage bag. Like I literally no. So it sounds absolutely crazy, but like shout out to my mom who's a genius. She cut like the garbage bag like this and then basically put it over my head. I stuck my hands and like literally covered my whole body, and I was able to shower. I don't know about you, but I like showering is like my thing. And it was so nice to be able to shower every single day. And that's what we would do. Like I would just like put one hand, and then I was able to like wash my face, wash my hair. It was great. That's my tips and tricks.
I can imagine you in a fucking shower with garbage bags.
Yeah, no, and it just like covers. It was like perfect. It just like, but she cut like 2 holes. I put my hands in, and it was great. So that was like the number one thing that helped me. What about you?
I waited a week to shower just because one of my friends told me, she was like, I got an infection from getting it wet too soon. So I waited as long as I could. And I'm like a clean freak. Like, like ask my friends. My friends know they are not allowed in my bed, even like sitting on my bed unless they're showered, like fully showered. So I'm like a OCD. So basically, my friend, shout out to Sierra. She's a nurse. So she came over with like hospital grade wipes, and she cleaned me because you can't move, like you're kind of like you have T-Rex arms. So basically, you can do like T-Rex things.
Yeah, that's actually so true.
Yeah, it's like T-Rex arms. So she would clean me. We ended up. My mom bought me a hospital chair, like a shower chair. Mm-hmm. So after the week of like gross bathing, I actually was able. We have a shower that had like a handle. So I made sure that I had my a tank top on just to cover like the incisions and stuff. And then the drains, I put like little shower proof drain holders, but the shower I would like wash and then like drain. So I didn't directly get the water on, but I was able to,
See, I did the same exact thing. Yeah. Like it was the same thing. I just like in case there was water that would, like come inside the garbage bag, just like protected it. Because it was cool because it has like the string. So you just pull the string so you pull the string this way.
Can we like patent like a shower, like a, oh my gosh, wait, this is a good idea.
Wait, this is a great idea.
Shower.
Wait, we can.
Okay, let's call your mom because she clearly has good ideas. Wait, we're about to be rich. Who wants to buy it first? But what else? So the recliner, So the recliner, 100% because for about a week, you can't really get yourself up.
So, yeah, it's like the feeling of just like that. I don't know. You need to have like good abdominal.
It hurts. So the recliner like pulls you up. Also on Amazon, I bought these like big fat pillows that go behind your back. So like when you're in the bed, if you instead of like it was like 3 a.m.
I didn't sleep in a bed for like weeks.
Well, it was like it would be like 3 a.m. I'm like, I don't want to call my mom to like come help me. So I made sure I slept with like you kind of have to sleep upright. And you kind of just have to like use your feet to like get down. And honestly, it was hard. And I didn't want to bother my parents because, you know, whatever. So I try to be as independent as possible. But those things definitely like like pillows that kind of keep like you forward. Another recommendation is take the freaking medicine. Take the Oxy. Take anything they prescribe you because it works. If you take the medication,
I didn't take any.
Well, I needed to.
But no, yeah, I mean, like I'm pro. Like when you're like, I don't want to suffer any day in my life, but I also don't want anybody else around me or anybody that I know or anybody in general likes to suffer. So it's like if it works for you, great. For me, like I just have never taken a narcotic.
I never in my life ever. I had my tonsils out 2 years ago, and I was crying, holding the Oxy in my hand, like I need something. My dad said, "Don't do it," so I didn't do it. But this time, I was like, you know what? My brother is a paramedic, and he was like, "Crystal," he's like, "This shit works.
Yeah,
I'm gonna be a drug addict."
Definitely doesn't. No, of course not. Of course not. Like, it's all temporary.
We did it. So the doctors were like, "You want to get ahead of the pain." So take the Oxy every 8 hours. So you could there's like Oxy every 8 hours and then like extra strength Tylenol and Motrin you could take like every 4 hours. Like,
it's around the clock.
Yeah. And honestly, I did that and it wasn't that bad. Like I took Oxy. I never got addicted. I took it maybe like 6 times. You know what I mean? So it helped me sleep a lot. So definitely any medication that you need, just take it, but don't get addicted, please. What else? The pillow. So definitely the pillow. So like when you're just hanging out on the couch, the lymph node dissection, if you get your lymph nodes dissected, that part hurt me the most.
Yeah, that part hurt.
So you don't want it to like touch your body. So having a pillow, and there's a pocket right here for your phone. So your T-Rex arms.
Your T-Rex arms.
Your T-Rex arms.
See, I was like reading a lot during my surgery. So that pillow did help me too because it had like that little pocket and I would put my Kindle like right there. And then I would just like wake up in the middle of the night and like read and then put it down. Like it was great. But yeah, those pillows really do help.
Pillow for your seatbelt.
I was going to say that also was huge too for me. But also like even placing the port, like that initially it bothered me. The seatbelt bothered me. Yeah. So I had that from before. Yeah. What else?
Clothing. So you definitely want clothing that you can buy it, but honestly, I learned that you could take your bathrobe and flip it inside out, and the pockets would be inside for your drains. So like people were I was buying all these robes, and I'm like, wait a second. If you flip your bathrobe inside out, there's 2 big pockets. You could put your drains in there.
Wait, I'm shocked right now.
Right? Like, hello, mastectomy queen.
Oh, wow. Yes. I did not know that.
So you don't have to go, because I was buying like bathrobes on Anna Ona.
I'm going to do that as soon as
we're done. Yeah, I bought an $80 bathrobe, and then like I was just like, wait a second. Wait here. So, because you have the drains, you don't want the drains to like flop around. So definitely drainage belts that go here. For the shower, you can put it around your neck. So t-shirts, sweatshirts that have pockets inside, just because, you know, to hold your drains.
Yeah.
I had drains in it for a total of like 3 months.
Oof.
Altogether. Yeah, it was pretty bad. What else? I know there's a lot of crap that I used. Why am I drawing blanks here?
I'm trying to think. I don't know. I like mine was like so.
Oh simple. Yeah. I was gonna say you definitely want to buy gloves because you do not want anyone touching you. So when you have to change your like drains, you have to empty your drains. That's a whole new process.
Yeah.
I didn't think about infection. That. You don't want people touching you because any kind of bacteria. I mean, I was clean. I only touched myself. My mom tried to help me drain milk the drains, and she was like, "Oh my God, I think I'm gonna throw up." She was getting lightheaded, so I had to learn how to do it all by myself. But I would wash those hands, put gloves on sometimes, because you just don't want to. I did everything precautionary, and I still got like 10 infections.
That was like the total opposite. I'm married to a surgeon. Like, yeah.
It was me, myself, and I. Like, I just wanted to be independent. Like,
yeah, I felt the same. I feel like you lose so much during this whole process, and so much is taken away from you that, like, especially your independence, which is like number one thing, and that's another topic that we can talk about another day. But it's like you want to be as independent as possible, and it's like so hard to be when like you are
T-Rex hands. Yeah, I know.
But yeah. What else?
Oh, I must say the expander exchange surgery at the very last one was not bad at all.
That's good.
Yeah.
That's awesome.
Did you do direct implants? Or you did expander?
Yeah. No,
you did direct implants.
Yeah. I was like, I work in surgery, so like I'm doing one surgery and that's it. Gotcha. And I gave him just like I was never given options. I was like, I'm not giving you an option. This is what we're doing. You're gonna go as big as you can without putting tissue expanders. And I got 255.
I got 430.
So but I am so happy. Like I am so happy with my outcome. And yeah, so it was great.
That's good. Yeah, that my second when I took the expanders out to put the implants in. Honestly, that surgery, I took a week off of work, and the second day I was like, "Can I come back to work?" Like I feel fine.
That's great.
I was cooking the next day. I was doing everything on my own, which that was pretty.
Could you imagine if we recorded all of this and the microphone's just like
oh my god, my microphone is definitely. Imagine it's like hello,
hello. Hello.
But yeah, so pretty much, we decided to do double mastectomies. The reason I chose to do double mastectomy was because I felt like under a microscope, there might be microscopic cancer cells floating around. You don't know.
That's fair.
So just to be safe, that's what I decided, because for me, if I just got a lumpectomy and just had the tumor removed and maybe I had a reoccurrence in 5 years, I would think back like, I should have been more aggressive. Why didn't I do the hardest thing that I could possibly do in the beginning so I could never get a reoccurrence?
Yeah. Yeah. I guess everybody's different. Again, like I still truly do believe that like there's no right or wrong answer. Like everybody's body's different. But I do feel like it's important. Like if you don't need them and you can get them replaced, like why keep that tissue in your body? It came from like the cancer came from somewhere, and that's the part that it came from. So it's like get rid of it. I'm a strong believer that like there should not be anything inside your body that shouldn't be there. So it's like just get rid of them if you can get them replaced. Like it's a really, really hard decision. When you have options, it's hard because it's like you don't want that to be taken away from you, just like you don't want anything taken away from you in your life. But I do believe that it's the best decision.
Yeah. No, and that's the thing. Like a lot of people like call me. Like I know that we're pretty big in the breast cancer community right now. So I get text messages, calls, Facebook messages. Like, can you talk to someone? They're deciding what to do. And I will never tell someone, get a mastectomy.
No, 100. Yeah, of course.
But I kind of act like a doctor. I'm like, well, here's what a lumpectomy is. Here's what a mastectomy is. This is this. This is this. This is the, mastectomy. It's going to hurt. It's going to hurt. It's a temporary couple week of being in pain, but that
for a long time. Yeah. For like a lifelong, life.
And here's the thing. If you get a mastectomy, you might get a recurrence. If you get a lumpectomy, you might not get a recurrence. We don't know. Yeah. But in my mind, I was just like, you know what? Let's get this shit. Chop these things off. And we ended up getting pathology back, and there was no cancer cells,
which is
anywhere.
So freaking amazing. Cheers.
It was pretty good news.
No, that's awesome. That's that was what you want.
But I didn't think, oh, damn it, I shouldn't have done that. There was never anything inside there. No, because still, even if you take all the tissue out, there could still be little cells. You never know.
Yeah.
But because of our age, a lot of women get diagnosed in their 70s, 80s. I have tons of women that call me in their 80s. They, no offense, they only have, 15, 20 more years to live. So they only have to live with this for a short amount of time. We have 50 more years of life ahead of us. So if we have to keep having reoccurrence, like what kind of quality of life is that?
Yeah.
So I thought hitting it head on, chemotherapy, double mastectomy, all that BS.
Yeah, it's a temporary thing.
So that's why I chose that. That was my opinion. And
words
also
to live by. I'm sorry, continue.
99.9 of the women that I talked to told me that was what they should do. And because of experience of knowing people that only had lumpectomies and the recurrence came back multiple times, you know, so God bless you.
Edit that out. Thank you.
We don't edit. We're on unfiltered.
Human rights are women's rights, and women's rights are human rights. I like that one.
Where did you get this book?
Actually, Dr. Mountain and I got it. Baptist gave it to us.
I love it.
Yeah. I don't know. I just wanted to read something. Something empowering.
So studious.
But yeah,
I think it's about that time. My phone's probably dying.
I was just going to say.
Wait, you bought a camera. We didn't even use your camera.
I know. That's what I said, the battery.
Oh, okay.
I told you the battery is
dead. Maybe next podcast we'll have like a real camera. We're still learning this.
Learning
like, we're learning everything.
It's so much fun, and we just want, to get the community engaged, and, maybe we can all talk together and like plan something. That way we can do something. It'd be fun.
Walk.
A hot girl walk would be so much fun. Who's in for a hot girl walk?
Hot girl walk. Let's do it. Let's plan it.
Yeah, let's do it. No, seriously, let's do it. Like we could do Key Biscayne Brickle. Like we could do something fun. Yeah. It doesn't have to be big. Like we're not,
Miami girls, where are you at?
Yeah,
I'm talking
girls.
like this, but I forgot my microphone girls, where you at?
Yeah, I know. Mine is like just like clipped on. But Miami girls, where you at? Let's do a hot girl walk.
Link up time.
No, seriously, let's do it. That would be so much fun. We could all wear like fun glasses and just like be pink, and then people will notice us. Like it would be so much fun.
Love it.
Yeah.
All right.
Alrighty.
Well, it's about that time. Steph's got to get to bed. She's got work and school. Oh my gosh. But we love you guys. Thanks for tuning in.